My passion for science started watching my dad doing experiments in his lab. Today I'm here with Dirk de Smale, one of my R&D colleagues in the Lion Building here in Belgium. And Dirk and his team is working very hard every day to bring medical innovation to patients. Our researchers focus on therapeutic areas such as blood and lung cancer, rare diseases, and vaccines against infectious diseases. So Dirk, tell me, what is all this hard work really about you do here in R&D?
Let me maybe start with stating that R&D and discovering, developing innovative therapeutics is a long and complex process. And we learned that a key success factor for us is to be able to tap into the best science. And that's science that either resides within the walls of our company, but also science that is available across the globe. So for us to have access to that science, no matter where it resides, is of utmost importance. Academic research institutes allow us to get basic insight into how diseases originate and how they evolve. But then at one moment in time, we as a company come to the table because we bring scale, we bring know-how, capability, and that is important to go from idea to actually having therapies available for patients.
I also believe that intellectual property rights are critical and we need a predictable framework for it. Can you explain me, what does intellectual property rights mean for you in R&D?
So we're a company that focuses on transformational innovation. So by definition, intellectual property is important to us. But there's another factor to add here, and that's the factor of risk, of uncertainty. Not every asset that we start working on actually makes it to the finish line. IP actually allows us to generate return for the value that we bring to patients and society once a therapy is available. And that's a return that we actually reinvest into developing new advanced life-saving and breakthrough therapies.
Indeed, eroding it or bringing it down to a lower baseline in Europe would also diminish the attractiveness for the life science sector in Europe. But sometimes intellectual property rights are criticized, and one criticism is that it slows down scientific progress.
I would like to counter-argue that statement, because the way I look at it is the following. Once IP has been granted on an invention, a product, a process, a technology, all of the details of the invention become publicly available, which means that at that moment in time, anybody, including competition, can start thinking and working on alternatives, better, more innovative solutions. So you see how actually IP drives and stimulates innovation and competition, provides options to peers, providers and patients, and actually takes costs out of the system. So Anouk, what is, according to you, at stake here with the review of the EU pharmaceutical legislation?
It's a once-in-a-generation opportunity to make Europe again a medical innovation hub for the future. There are, of course, also access concerns that need to be addressed to ensure patients will have access to the innovations that you and the researchers are bringing to them. But breaking down IP is not the solution. It would be a lose-lose-lose situation for the patients, for the industry, and for the governments. So I think rather we should be working together with the governments and build proposals that will address the access concerns, but not breaking down intellectual property rights. This is the fuel to innovation, and this review of the pharma legislation is the way to really try to make the legislation future-proof.